Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Diffuse tensor imaging. So under diffuse tensor imaging, this is totally based on the anisotropy. So anisotropy of the white matter. So we are going to look at the diffuse tensor imaging and also along with it the bold MRI. So diffuse beta imaging is based on the anisotropy. So anisotropy is seen based on the anisotropy, and this is of the white matter tracts. Next is there is also the tractography. There is something known as a tractography. And tractography, the white matter tract is colorful. Matter, it appears colorful. So the diffuse tensor imaging, it is based on the anisotropy of the white matter tracts, as well as the tractography, the white matter tract appears colorful. Next is looking at the bold MRI. Under the bold MRI, the blood oxygen level, it is dependent on the MRI. So blood oxygen level, it appears on the MRI. Next, it is also known as a functional MRI. So functional MRI is nothing but the bold MRI, and it helps to localize the functional areas of the brain. And it activates the areas by stimulating by the stimulus. So activates areas by giving stimulus. So activates the area giving the stimulus, and that area gets lighted up. So give a stimulus and that area gets lighted up and helps in the neurosurgery planning to avoid the damage to the adjacent areas. So avoiding the damage to the adjacent areas is the function. To learn and grow daily like this, please do subscribe.